So if I'm going to talk about the true one, I'll just draw it with red. So if this is my uterus, this is my, or these are my fallopian tubes. So if this is my uterus, a true fibroid is going to be completely situated in the broad ligament without having any connection. Whereas if it's a false broad ligament fibroid, then it is going to have a mass like this. It is going to be basically attached in some way to the uterine wall. Now, how does this make a difference? The difference is that when I talk about the ureter, this ureter in a true ligament fibroid is going to be displaced medially by the broad ligament fibroid, whereas this is going to be displaced laterally. So the ureter is going to be displaced. And because it may be difficult while removing, if I'm doing a myomectomy, if I'm enucleating this myoma and if I'm removing it, then if I do not recognize the ureter, I can end up injuring. So what do we do? Before the surgery, pre-operatively, we put DJ stents. Basically, ureteric stents are put so that when I'm operating between my index finger and my thumb, I can feel the DJ stent, and that is how I will know that this is the ureter and I cannot be going anywhere near it. So that is how it is very important in gynae surgery of myomectomy for me to know. Apart from that, if I'm going to be doing any retroperitoneal dissection, so if I'm doing any retroperitoneal dissection, which can be for any lymph node dissection or for any mass retroperitoneal, or if I'm going to have a broad ligament hematoma that has occurred. So in that scenario, I might have to go into the retroperitoneum, or if I have to ligate the internal iliac artery in case of PPH, traumatic PPH, where the bleeding is not stopping by ligating the uterine arteries. So in that scenario, I'll just switch on my AC, sorry. Yeah. So in that scenario, I have to remember that it is very important during retroperitoneal dissection for me to be able to recognize the internal iliac and the ureter separately and to ensure that I do not injure any other structure over here, which is the ureter. So retroperitoneal dissection for either lymph node dissection or internal iliac artery ligation or any other reason, I have to be sure about the retroperitoneal part.